Discussion. Standing with me right here to help talk about what the latest is with regard to where this health care reform proposals are going is Congressman Dave Camp. He is the ranking Republican on the House Ways and Means Committee. Sir, thanks so much for joining us.
Good morning, Lindsay.
Let me get your first take on all these proposals in general. Where do Republicans stand on some of these Democratic ideas?
Well, the problem is, any way you slice it, there's $1 trillion in new taxes. Look, I'm from Michigan. We have 14% unemployment. The last thing we need to do is raise taxes, and particularly the taxes they're talking about. Half of those people are small business owners. If we're ever going to recover this economy, we're going to do it through the engine that's always driven our economy, which is small business. And what they're doing is throwing this huge wet blanket over any possible recovery.
Well, let's talk about small businesses and the threat that's posed to them by some of these proposals. I mean, can't you argue that the skyrocketing cost of health care poses an even greater threat to small businesses than some of these proposals to reform the health care system?
Well, the problem is the employer mandate they have in their bill. This is an 8% tax. If you use their economic analysis, will cost us 5 million jobs. So what we don't need to do is put people out of work to provide them something they may already have. 85% of Americans have health care. What we need to really do is target those Americans who don't have health care, and you can do that. What they're doing is trying to give people health care that's government run, who already have it through the private sector. I think that's a bad formula.
Let's take it piece by piece. This latest proposal to gain some traction among Democrats, the surtax on high earners of $250,000 or more, does that even have a remote possibility of passing muster with Republicans?
I don't think so, because, as I said, half those people are small business owners. We want the small business community to recover, to start to add jobs. And what this will do is you put yet again another tax. This is after almost $1 trillion in taxes on energy, which every American will pay, whether you're in your home or in your business. And so when you add up what they've spent on stimulus, what they've spent in terms of taxes on the energy bill, what they hope to spend on health care, providing health care to people who already have it provided for their employer, and not really targeting ways. There are ways to improve health care. For example, if we let small businesses and states group together and create a bigger pool, that actually does bring down costs. If we have liability reform, which you notice they never mention, that's estimated to save almost $100 billion a year if we could stop the duplication and defensive medicine that's being practiced. There are some good ideas out there that we have to offer. They're not considering them. I think they're going the wrong way by really trying to have the government take over health care. They've already taken over insurance. They've already taken over automobiles, right, and now they're trying to take over health care.
Well, what do you make of the deals that the White House appears to be cutting with various facets of industry? We're talking about yesterday's deal with hospitals, other deals with pharmaceutical industries, more deals to come. What do you make of those?
Well, I think if you go back home, these are Washington leaders of these associations who, quote, want to be at the table. What they don't understand is they're on the menu at the table. And I think when you go back home and talk to people actually in our states and our districts, they have a very different view of these cost-saving measures. So they're going to cut their deals, but I think we have to look at really what's right for the American people, what's going to help them, what's going to get our economy recovering, what's going to help with health care costs. We need to get the cost out of health care. They don't do that. They actually add to that.
Real quick, talking about a potential tax on employer-sponsored benefits, that's something Republicans in the House have seemed to have supported, although a lot of people think this could be very harmful for individual consumers. Real quick, what do you think of that?
I don't support that idea. There's a very small minority of people who do. It's still on the table in the Senate. I think to actually tax health benefits really would break the president's promise. If you like what you have, you can keep it. That would absolutely change that dynamic.
Finally, end of the day, you think anything will get done by the August 3rd recess? I know you're not a Democrat, but...
Well, I think that's an artificial timetable. I think we've got to really try to get it right and not necessarily agree to just some timetable that doesn't mean anything.
Okay. Congressman Dave Camp, ranking member of the House Ways and Means Committee, thank you so much. We'll send it back to you in New York, Betty.